everyone, I'm Frances, and for today's video I'm going to discuss how to promote health and safety in the new normal through health protocols and healthy living. So before I start, I just want to introduce myself. I'm a staff nurse in the Philippines for 2 years, and currently I am based here in Cambridge, and I work here as a staff nurse as well. So I hope you learn a few things about COVID-19 in this video. So in this video, I'm going to discuss 3 main points. So the first one is, what is COVID-19 and what are the health risks and dangers associated with it? Number 2, I'm also going to discuss different government protocols and measures that we should take in consideration to help stop the spread of the virus, and also the reasons why we should follow it. And the third one and the last one is, how do we promote our health and how do we protect it from COVID-19, both physically and mentally. Just to let you know, most of the health protocols and advices that I will discuss in this video are from the Department of Health in the Philippines, but I will also going to incorporate a few things from gov.uk. What is novel coronavirus? So novel coronavirus, it is a strain of coronaviruses that has not been previously identified in humans. So in February 12, 2020, the World Health Organization has announced that the new disease is officially called coronavirus disease 19, or as we all know it, COVID. So first of all, let's go through the different health risks and dangers of COVID-19. So the 3 main symptoms of COVID-19 is a high temperature, a new or continuous cough, and lastly is a loss or change in the sense of smell. It is also very important that we remember that most people get infected and they don't even have any signs or symptoms, or they don't feel unwell. So it's just an important thing to remember. Additionally, older people or those people who have underlying medical conditions such as hypertension, asthma, heart conditions, or diabetes are most likely to develop moderate to severe cases of coronavirus. That is why in our hospital, all of the staff undergo risk assessments so that we can identify people who cannot work on COVID wards, or most of the staff that are high risk are not allowed even to look after suspected COVID patients. And the hospital also allow staff who are at high risk of acquiring COVID to work from home if possible. So let's move on to our second topic, which is one of the most important topic that I will discuss, is the different government health protocol and measures to stop the spread of the virus, and also the reasons why we should follow them, because a lot of people would challenge these measures or protocols and ask why we should do them, why we should follow them, and it's very important to actually educate ourselves as well. So before we discuss the different health measures and protocols that we should follow to stop the spread of the virus, it is also very important to know, how does this COVID-19 spread? So COVID-19 is transmitted through via droplets, contacts, and fomites. So it is usually transmitted when a person coughs, talks, sneezes, releasing these droplets of saliva that contains the COVID-19 virus. So again, all of the protocols and measures that I will discuss in the following minutes are from the Department of Health in the Philippines. So the Department of Health advises all public to practice protective measures. This is still the best way that you can protect yourself from COVID-19. So first off is, of course, we need to practice frequent hand washing. So we have to wash our hands with soap and water for at least 20 seconds. So hand washing is still the most effective way to protect yourself against all viruses, and that includes COVID-19. Second one is we should practice proper cough etiquette. So please cover your mouth and nose when you are coughing or sneezing, or use the bend of your elbow to cough, and please stay away from people when you're coughing or sneezing, and always wash your hands afterwards. The third one is to practice social distancing, and this means to stay at least 1 meter away from another person. So why is that? It's because, as I've mentioned earlier, viruses can spread through droplets, and this happens when one person is sneezing, coughing, talking, or even eating. So it is very important that we practice social distancing. Here in the UK, most of the shops, restaurants, or even workplaces have a one-way system. So the floors have markings in order to make sure that people have something to follow in order for them to navigate the space and to prevent people from bumping into each other. And also, most shops here limit the people inside their stores. So some of the shops practice 2 in, 2 out, and stuff like that. So it is also one way on helping stop the spread of the virus. And the next one is wearing a mask. I believe that back home, people are now using masks whenever they go out, and I think the government has also advised people to wear face shields in addition to that. Here in the UK, they've just recently required people to wear masks, especially when they go inside shops or restaurants. So just a little story, when we went to Brighton a week ago, I've witnessed a lot of people challenging staff because this staff won't allow them to go inside without the face mask. So it's a bit disappointing because these people are just doing their jobs, and it's not that hard to actually wear a mask and just follow the rules. You're all by doing that, you're protecting yourself and you're protecting other people as well who are vulnerable in getting this disease. So next, I'm going to talk about travel restrictions. So travel restrictions at these times are very volatile, and that they can change rapidly as new developments emerge. So it is very important to do a little bit of research whenever you want to go to a certain place, just to check with their local procedures or policies, especially their isolation procedures. And also, if you want to be updated or be up to date with the Department of Health travel advisories, you can go to their dedicated webpage for COVID-19. So it is www.doh.gov.ph/2019-NCOV. So you can get travel advisories there. So the next topic that I will discuss is what are you going to do if you have signs and symptoms of COVID, or if you think you have been infected with COVID-19. So first of all, you have to contact your BERT. So BERT is your Barangay Health Emergency Response Team. So they are usually the one responsible for your COVID-19 testing and referral. So while waiting for that to happen, you can already prepare IDs, your PhilHealth IDs. You can start packing your clothes, toiletries, face masks, cell phones, what else? You can have your maintenance medications on hand if you have any. It's just in case that they will advise you to be admitted, so just you're ready. So once you've made that contact to your BERT and you are qualified for a COVID-19 testing and the BERT has done the referral, usually you will stay on a TTMF and undergo testing there. So it's a temporary treatment and monitoring facility if you have mild symptoms. Otherwise, if you have moderate to severe symptoms, you will stay in a hospital. Okay, so just to recap, when you have signs and symptoms of COVID-19, or you suspect that you've been infected with COVID-19, so just remember, first one, you have to isolate yourself. Second, you have to inform your Barangay Health Emergency Response Team of your condition. And third, you have to undergo testing, and you will stay in a temporary treatment and monitoring facility or in a hospital. So additionally, you can also try these few tips to relieve your symptoms. So remember, these are just to relieve your symptoms, and this is not a cure for COVID-19. So firstly, you can drink or take paracetamol if you are having a high temperature. Second, you can drink warm tea or take some lozenges just to relieve your sore throat. And of course, get enough sleep and drink plenty of water. So our last topic for today in this video is how do we protect ourselves from COVID-19, both physically and mentally. So as we all know, 2020 has been a very challenging year, and there were a lot of changes that happened that we were not prepared for. We didn't prepare for this mentally and physically, financially as well. So these changes can cause a lot of frustrations, anxiety, of just very negative feelings. So it is important that we check on ourselves as well, and that we look after our feelings and as well as our bodies. So first of all, we have to keep in touch with people. So we can do it. We can talk to friends, to family, online or over the phone, with respect or physically with respect to social distancing, of course. So it's very important that we are able to vent out our feelings to close friends and families. So secondly, look after yourself. Drink a lot of water, eat healthy foods, exercise from home, and please avoid smoking or drinking too much alcohol. So third is think about your new routine. Make a plan of your day ahead, and get enough sleep. So a couple of months ago, me and my housemates were placed in isolation. So it's a 14-day isolation because one of us was having symptoms, and thankfully the result was negative. But regardless of the result, we were still asked to finish the 14-day isolation. And during those days, we made a routine for ourselves, and it's just something to provide structure to your lives, and also it's something that you look forward to every day. Next is do things you enjoy. So it can be reading, writing, listening to music, playing games, painting, drawing, anything. So find time to relax. But also, if you don't feel productive, that is okay as well. Don't pressure yourself with what you are seeing in social media. If you haven't done anything the whole day, that's okay as well. Give yourself time to relax and recharge your battery. So next is you can enjoy nature. So if you can, go outside and exercise once a day. But remember, of course, to social distance. If you have a garden, spend your time in it. If you don't, you can try growing plant indoors. I've done it. It's very relaxing. It's very fulfilling. It gives you a sense of achievement when you see your plants thrive. So I recommend you try it as well. And lastly, don't be too worried about the news. It is important that we educate ourselves, but also try to watch news just once or twice daily. And remember to get the facts. Not everything that you hear or read on social media is true. So it's very important that you get the information about COVID-19 on official government sites. So in the Philippines, you can visit the Department of Health website to get the information there. And here in the UK, you can go to Public Health England in gov.uk or the NHS. So that's it. I hope you learned a lot of things about COVID-19 on this video. And before I go, if you want, you can go to the DOH, Department of Health Philippines Facebook page. You will find more information there, and they also made a new Facebook page as well called Bida Solusyon. So they post a lot of infographics there that are very easy to read. So if you want, you can like those pages and get updated about COVID-19 in the Philippines. So thank you again for watching. Hi everyone, so it's Frances. For today's video, I'm going to discuss Hi everyone, so today's video is about promoting health and safety. Discuss here in this video is from the Department of Health.